This module will go over what to expect on the day of surgery for your shoulder replacement. You will receive a call the day before surgery in the late afternoon alerting you what time to report to the hospital or surgery center. If your surgery is on a Monday, you will receive the call on the Friday before. Remember to stop any clear liquids 3 hours prior to the scheduled surgery time. What should you bring to the hospital or center? Clothes that are easy to put on and take off, closed-toed slip-on shoes, a legal photo identification card, an up-to-date insurance card, cell phone, and a book or other form of entertainment. Do not bring valuables such as rings, jewelry, or watches. Remove these and leave them at home, and also leave any prescription medications at home. First, you will check in and register. At Portsmouth Hospital, this is inside the main entrance to the left. At Stratham Ambulatory Surgery Center or Atlantic Coast Surgical Suites, this is in the main waiting area inside the main entrance. You will then be escorted back to the preoperative holding area where your belongings will be stored, and you will be assigned a room or a bay and change into a gown. The same-day surgery nurse will complete your admission process by reviewing your medications, allergies, surgical preparation, recent health issues, and the planned procedure and postoperative course. An IV will be started for hydration, and the nursing staff will then wash down the surgical site with special antiseptic wipes to help reduce the risk of infection. You will be given several medications for preventive analgesia. The anesthesia team will meet with you to discuss their plan and obtain anesthesia consent. Your surgeon will see you in the same-day surgery unit to confirm the site of surgery and mark that site. And members of the OR staff will recheck and reconfirm the planned procedure and consent and then escort you back to the operating room. Most patients undergoing shoulder replacement will receive an interscalene block prior to surgery. This is done in the preoperative holding area by the anesthesia team. This block will numb your entire arm for 12 to 24 hours after surgery to minimize postoperative pain. You will not be able to use your hand during this time and should keep your arm in the sling until your muscle function returns. In addition to Dr. Parsons, there will be a team of experts taking care of you in the operating room. This includes an anesthesia provider, physician assistant, operating room nurse, surgical technician also known as a scrub nurse, and a second assistant. Each member of the team has a dedicated role to ensure your safety. You will be continuously monitored during the surgery, and your safety is our #1 priority. When surgery is complete, you will be transferred to the post-anesthesia care unit, also known as the PACU. Here, a specialized PACU nurse will continue to monitor you and care for you as you wake up from anesthesia. If you have any discomfort, they can begin to administer medications for this. A typical stay in PACU lasts for about 1 hour, but occasionally this may be shorter or longer depending on circumstances. The following criteria will be evaluated and completed to ensure your safe discharge. Your discomfort needs to be well managed and tolerable. You need to have stable vital signs. You need to be able to urinate, and you need to be able to hold down food and liquid. Either the nursing staff or a therapist will also work with you and educate you to ensure your safe mobility and ability to manage basic activities of daily living. Once you have met criteria, you and your caregiver can transition from the facility to home. You will be wheeled to the car in a wheelchair or in some cases walk there. Therapy will assist you in getting in your vehicle and educate you on the best way to enter and exit it. You will be given instructions on continuing the multimodal pain management regimen according to the provided schedule.